Hi, my name is Candace Middlesdorf, and today I'm going to talk to you about the cardiovascular system changes in the older adult. First, let's review the learning objectives. At the conclusion of this presentation, students will be able to identify principles related to normal changes in the cardiovascular system in the older adult. They'll be able to utilize these principles during patient assessment, and they'll be able to apply these principles during patient care interventions. First, I want to talk to you about some normal changes of aging. The older adult will have decreased cardiac reserve. At rest, this is not going to change their resting heart rate, cardiac output, or ejection fraction, but the older adult's ability to increase their heart rate will be affected by physiological stress. The older adult will also have a decreased attainable heart rate, functional reserve that leads to exercise intolerance, shortness of breath, fatigue, and a slow recovery from tachycardia. The older adult will have increased wall thickness and stiffness, which results in decreased vessel compliance and a higher SVR. They may also lead to increased risk in isolated systolic hypertension and wide impulse pressure. The older adult will develop strong arterial pulses, they'll have diminished peripheral pulses, potential inflamed varicosities, and cool extremities. Let's take a look at a few more. The older adult will have an increased workload against non-compliant vessels, and this is going to lead to left ventricular and atrial hypertrophy. The older adult will also have a diminished beta-adrenergic sensitivity that will lead to blunted sympathetic response in the heart and a decreased myocardial contractility. And so that's looking at the sympathetic nervous system. The older adult will have sclerosis of atrial and mitral valves, leading to aortic regurg or mitral stenosis, which is going to cause murmurs. There's going to be a decreased conduction cell, and this is going to be the decreased cardiac cells. It can also lead to increased arrhythmias, such as PACs, PVCs, and atrial fibrillation. There's also going to be an impaired baroreceptor function, causing changes in blood pressure. And this is going to definitely affect changes in blood pressure as far as position changes, such as orthostatic hypotension, dizziness, and increased potential for falls. I want to take a minute to review this slide. This is looking at the structural versus functional changes of the different cardiovascular structures. So real quick, looking at the atria, the structural change is going to be increased left atrium size and thickening. The functional change related will be increased atrial irritability. So that's when they're going to have those increased arrhythmias. The left ventricle is going to have a structural change of myocardial thickening, fibrosis, and infiltration of fat, which will lead to a functional change of decreased compliance, cardiac output decline, and prolonged systole. The valves will have the thickening and rigidity of the AV valves, which will lead to abnormal blood flow across the valves, which is going to cause that regurg and stenosis, leading to murmurs. The conduction system will have a decreased cardiac conduction cells. The functional change will lead to slower SA rate in conduction, so you'll have that slower heart rate. The sympathetic nervous system, you're going to have that decreased response to the beta-adrenergic stimulation, which will cause the functional change of contractility and heart rate to be slower, and it's going to be a slower response from exercise, and the heart rate will take longer to recover from the baseline. Looking at the aorta and the arteries, the structural change, you'll see stiffening of vasculature with decreased elasticity. The functional change related is left ventricular hypertrophy. And then lastly, looking at the baroreceptor response, you're going to see a decreased sensitivity, which leads to episodes of hypertension and hypotension functionally, causing that slow response to changes in body position. I want to take a brief moment to look at this picture. This picture is showing a young versus an age heart. You'll notice the normal versus the hypertrophied changes. You'll also see that there's a decrease in cardiac conduction cells and a replacement with senescent cells, which senescent cells are cells that cease to divide. And according to one study, senescence of endothelial and cardiac cells observed over normal aging appear to be accelerated in age-related diseases, and in particular, cardiovascular disease. And this is something worth noting when you're looking at the older adults' cardiovascular health. Next, let's talk about assessment strategies. When you're assessing the older adult, it should always include performing an EKG. You're looking at the older adult's rhythm changes, you're looking for any of those arrhythmias. You also want to monitor their heart rate, their heart tones, and any occurrence of murmurs. When you're looking at the heart rate, a normal heart rate is 40 to 100 beats per minute. When you're looking at the rhythm, you want to look for regular versus irregular. When you're looking at heart tones, you want to notice if there's an extra heart tone, such as S3 or S4. And when you hear a murmur, notice the location. Also noting that the apical impulse will be displaced laterally. It's also important to palpate for pulses. When you're palpating for pulses, you want to look for symmetry and strength. You should also assess the older adult's lower extremities for any swelling, dilation, or presence of varicose veins. The blood pressure is also something very important to assess in the older adult, especially with the changes in position. You should always assess the older adult's blood pressure sitting in a comfortable seat, feet flat on the ground, back against the chair. Then you should assess it about 5 minutes later after resting, and you should always assess the difference between supine versus standing when you're looking at blood pressure. Now, I want to talk about a few things related to the older adult and their ability to live independently. You always want to make sure that your older adult patient has that quality of life, that they are living the way they want to live. But there's some things that are important to mention. After you've assessed the older adult and you've given them that good, full cardiovascular assessment, you want to make sure that you are reporting any kind of rate irregularities, any asymmetric pulses. You also want to refer the older adult if they have any episodes of dizziness or changes in mental status. It's always important to incorporate education related to fall prevention. Due to the changes in blood pressure with position change, you want to make sure that they know items such as changing position slowly or making sure that they wait several minutes before standing. You should always educate the older adult about sufficient fluid intake and adequate hydration, and you want to make sure that they are not at risk for that hypovolemia. Encouraging cardiovascular fitness in the older adult is also important, but you want to make sure it's age appropriate. You want to make sure they know about having a healthy diet and eliminating tobacco use or exposure. All of these items are important for making sure the older adult can live independently. This last slide is a slide of my references. You're welcome to look at any of these. I want to take a moment to thank you for listening to this presentation about the changes in cardiovascular health in the older adult. Thank you.